I really know that the followers on Instagram would be really surprised for this 2022 that I am again live on the Instagram. So I'll wait for our members to join in. Most importantly, the Instagram, the video duration should be less than 15 minutes. Okay, that's the new policy which Instagram has taken, I think, in the past 6 months. So videos beyond that 15 minutes will never get saved. We will be able to go live and stream, but we will not be able to save it. So people might watch and listen directly, but they cannot watch it later. So because of that one reason, I prefer to come live on the Facebook page. Otherwise, I always prefer the Instagram because here the screen sharing is very easy. Viewers can even share the screen very easily, and Instagram works with the least internet connectivity, the speed also, compared to Facebook. Okay. I have come here actually to talk about the missing thing here in the skeleton. We always read the musculoskeletal system as part of the somatic structures. The human body is complete only with including the visceral system. We can study the nerves because we have neurology, specialty in physical therapy, and of course orthopedics, and you have cardiopulmonary, all that. But the cardiopulmonary specialty also, they take care of post-operative patients for abdominal surgery and also vascular surgery. We have in our physiotherapy curriculum as physiotherapy for general medical and surgical conditions. So this is something which is more of what is called as applied aspect of what is the viscera disorders. They got operated and we are giving physical therapy post-operatively, or people who have got actually visceral disorders, non-operative also, they might be under medications and medical management, pharmacological management, and it may be a carcinoma where the patients come to us for pain in the cancer, or it is because of the functional limitation due to the carcinoma. At every stage now it is recognized that as cancer can affect every organs of the body, same way we have every organs of the body working together for a functional activity. If you have poor cardiac function, you cannot do a particular activity of walking also. The same way pulmonary function, it's essential for doing any kind of a daily activity. Digestive system, urogenital system, everything is part of the functional activities. We can't say that only the somatic or the musculoskeletal system alone participates in the functional activity. So when we have a functional orientation in our evaluation, which is biomechanics or the understanding of pathomechanics, and after that a functional orientation in recovery or the rehabilitation of the person returning back to normalcy or with an enhanced quality of life, we need to really see that structures of the body are interdependent on each other. You have muscles getting the trigger point because of oxygenation, the blood circulation, our calcium deficiency, the metabolism and the nutrition, lot of factors which affects muscle metabolism, and that leads to myofascial trigger points. So always remember that visceral system is very, very important. And as we see through this important phase of 2022, after 2 years of struggling with the pandemic, AOMPT is launching the Viscerosomatic Manual Therapy course. So this course explores how we can treat the somatic manifestations which are having a coexisting visceral problem or primarily a visceral problem, but now the patient is having shoulder stiffness or having a lumbar radiculopathy after a renal problem. So there are a lot of relationships between this viscera and the musculoskeletal structures. Best example is the diaphragm, which is actually a somatic structure, but it is actually dividing the body into upper and lower compartments, where both the sides there are viscera. Below it is liver, stomach, spleen, pancreas. When you are seeing above, it is the lungs, heart and the esophagus with the mediastinal large vessels, aorta and the inferior vena cava, which passes through the two crux of the diaphragm posteriorly. So, a breathing can influence visceral structures. Breathing is also been recognized as affecting the somatic structures as breathing pattern disorders. So, breathing is the vital energy of life, okay, where you are actually getting the good oxygenation and the what is called as a purification of the body through breath. So again, to understand and apply a comprehensive treatment model so that the patients become better from inside, not just treating outer portions, muscles and the joints or the bones or the nerves, but we treat them from inside. It becomes a holistic treatment. And I, Professor Senthil P. Kumar, the Chief Instructor of the Academy of Orthopedic Manual Physical Therapists, who's been a front runner in providing best courses, integrating the fundamental knowledge of physical therapy and also the recent advancements, but applying them in a patient-centered model. Okay, so the combination of, it's not just the visceral manipulation or visceral osteopathy, you are going to integrate even a neural mobilization, vagus nerve, or you are going to integrate visceral facial releases, okay, or you are going to integrate even the spinal manipulative thrust for specific visceral organ dysfunctions. And clinical anatomy for this viscera is going on system wise, and we are going to see one by one, because system is actually an organization of visceral structures to perform a particular function. So functional classification of viscera means it is the visceral systems, the respiratory system, the circulatory system, reproductive system, or the what is called as, you have urinary system or excretory system, endocrine system, lymphatic system, so a lot of things. So what I want you to understand here is, the physical therapists and interns, please don't miss this course, Vsmt, Viscerosomatic Manual Therapy. Get in touch with me, register for the course and explore the 2022 inside the human body, the deepest. So let's get visceral. Welcome you all.